Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the award-winning Hospital Finance Podcast. In the 2021 IPPS proposed rule, CMS is proposing to amend its existing bad debt regulations for the upcoming fiscal year. To tell us about those proposed changes and their implications, I'm joined by Jaycee Lin, Senior Consultant on the Reimbursement Services team at BESLER. Jaycee, welcome to the podcast.
Well, thank you, Mike. It's always great to be on the podcast.
Always great to have you. So let's start out, Jaycee. As I mentioned in the opening, CMS is proposing some changes to its bad debt policies. What are they proposing and why?
Well, this has always been the age-old question as to how CMS is always updating their quote-unquote reimbursement requirements, and it's always been a mystery for the hospital to try to keep up with all the requirements. And basically, CMS proposed to codify the requirements of additional requirements that hospital must satisfy in order to claim bad debts from Medicare through this particular published notices and comments rulemaking. And if CMS doesn't do it, then they won't be able to enforce these particular updated requirements. And so the fact that CMS proposed to adapt some of the additional requirements retroactively, that signifies that CMS intends to apply these rules to open or reopenable past cost reports.
Yeah, I think retroactive is the key there, isn't it?
Yes, it is. And so at this point, all the hospitals are on the hook to be able to get the cost reports reopened with or without their proper acknowledgement.
So, Jaycee, what are the new proposed minimum requirements for bad debts?
Well, it's not really the proposed, the new requirements. It's just to up there and reinforce their requirement that hospitals must bill Medicare beneficiary no later than 120 days after the date of the Medicare remittance advice. And the new rule, of quote-unquote updated regulation, would also bar hospitals from writing off a bad debt sooner than 121 days after issuing the bill. Now, keep in mind, the 121-day period would reset each time the patient makes a partial payment. CMS will prohibit hospitals to claim bad debt that is written off to a contractual account, as hospital must claim bad debts that is written off to a bad debt expense account in the provider's financial records. And that is the key right now. Is typically a hospital would write it off to their contractual allowance as soon as they get a type of transaction from the hospital, from the patient, or from their insurance policy, let's say for Medicare or Medicaid accounts, and they would just simply write off on there, right? But now the Medicare would like to see that it's written off to the actual bad debt expense. So that is the big updated change at this point.
Got it. And individual claims should be filed with the cost report filing. What are the minimum fields required to do this correctly?
Yeah, that's always been the same format that CMS has reinforced via their Medicare intermediaries in the past. So that there is no change, but again, all hospitals should keep in mind that there are the 10 minimum required fields in order for them to reimburse for a bad debt account. And the accounts, the field in the data should have minimum to have at least 10 fields, and they would include the patient name, the social security number, and the date of service, along with whether a patient qualified for the indigent write-off, whether that was through their mean of tax or income, or simply have both Medicare and Medicaid coverages at any given point. And then lastly, they would show the date of the service that the beneficiary was sent a quote-unquote bill in order to show that their fair share of Medicare deductible and coinsurance, along with the Women's Advice date. And then lastly, the most important field is the balance of the account, basically to simply show the patient that they have what's dutifully done, the Medicare bad debt regarding the Medicare deductible and coinsurance amount. So those are the very minimum required format, and each hospital can definitely go through with their standard format that they have in their system, and they should be able to extract those important fields in order to qualify for Medicare bad debt reimbursement.
Got it. And Jaycee, what do you think these changes are going to mean for hospitals going forward?
Well, Mike, it just simply makes it harder and harder for hospitals to receive bad debt reimbursement. It appears that CMS is making changes to reflect longstanding policies that have existed for decades, if not since the time the Medicare deductible and coinsurance have existed. But at least the requirement that hospital must factor a patient's resources and assets in making the charity care decision is a significant and substantial change from the past policy. And then the Medicare intermediary will likely pay more attention in allowing bad debt claims in the cost reports in general. And therefore, each hospital's Medicare reimbursement for bad debts will be harder and harder to be allowed through the cost report.
Jaycee, thanks so much for coming by the podcast today and helping us all understand more about upcoming changes to bad debt.
Yeah, that's always my pleasure, and it's always it's easier said than done. So each hospital should definitely pay attention to all the audit requirements.
Thanks, Jaycee.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit BESLER.com/podcasts. The Hospital Finance Podcast is a production of BESLER. Smart about revenue, tenacious about results.